My name is Tobias Reichlin. I'm the head of the electrophysiology at the Hospital Bern in Switzerland. And we're going to discuss today the results of the COMPARE-CRYO study, which was a randomized comparison between two cryoballoons, and the results were presented yesterday at this ESC meeting. So cryoablation was introduced into cardiology around the year 2010. And there was basically one cryoballoon from Medtronic called Arctic Front. And that was the prototype of single-shot ablation for the treatment of atrial fibrillation. And that has been used for a long time in more than 1 million of patients. It's an excellent tool. And then in the year 2020, another cryoballoon was introduced called PolarX from a different company, Boston Scientific. And that's basically the background where we did our trial. So the novel cryoballoon was designed with the aim to improve efficacy and safety of cryoballoon ablation. And so some of the modifications that were done, it was a compliant rather than a non-compliant balloon. So the idea was that this would allow for a better vein occlusion. And then second, the novel balloon maintains a stable balloon pressure and a stable size during the ablation, while the other balloon enlarges a little bit. So sometimes the balloon pops out, and the idea was that this balloon will not pop out. And then third, there were several enhancements made to the user interface, including foot switches and more interactive user face to improve the cryoablation. So the patient population was patients with paroxysmal atrial fibrillation planned to undergo catheter ablation for atrial fibrillation. It was all patients with paroxysmal atrial fibrillation, and those patients were randomized 1-to-1 to be ablated with the PolarX Cryoballoon from Boston Scientific or with the Arctic Front Cryoballoon from Medtronic. At the end of the procedure, all patients were fitted with an implantable cardiac monitor, a reveal link, to allow for continuous rhythm monitoring. That's the most rigorous way of monitoring the rhythm, so that no episode of atrial fibrillation would be missed, and so that we would have not only information on AFib recurrence or not, but also on AF burden. And then the primary endpoint of the study was recurrence of any type of atrial arrhythmias lasting longer than 30 seconds between days 91 and 365, so excluding a blanking period of 3 months. So the key finding was the recurrence of atrial arrhythmias occurred in 47% of the patients with the established cryoballoon from Medtronic, and in 41% with the novel cryoballoon from Boston Scientific with the PolarX Cryoballoon. And so these numbers met the criteria for non-inferiority. It was a non-inferiority design because we compared a novel balloon versus an established balloon. Subsequently, because non-inferiority was met, we tested for superiority, and there was no difference between the two balloons. So that was the one key finding. In terms of safety, I have to say that both of the balloons were remarkably safe. There were no cardiac tamponade, there was no stroke, there was no fistula, there were no access complications. However, there was a 5% rate of phrenic nerve pulses that would not recover within 24 hours with the novel cryoballoon, while there was no of those phrenic nerve pulses with the established Medtronic cryoballoon. So now I think physicians can choose between one cryoballoon that has been out for 10 years, where there is data from randomized trials that it's non-inferior compared to point-by-point radiofrequency ablation, and that it is superior to anti-arrhythmic drug treatment. We have now the trial showing that both cryoballoons have the same performance. So I think now physicians can also pick the PolarX cryoballoon and expect that it has the same performance compared to the Medtronic cryoballoon. So I think our field is seeing big change into new technology called pulsed field ablation. And now the big question in the room is, how would cryoablation compare to pulsed field ablation? And this is some data has been presented in this meeting, but we ourselves are on a way of completing a trial that is randomizing patients cryoballoon versus pulsed field ablation. And I think this will be very interesting going forward to see whether the one technology has advantages over the other.